1,218 more Utahns have tested positive for COVID-19 just since yesterday's case count from the Utah Department of Health. Nearly 1 in 4 of those new cases are children ages 5 to 18. Today's report also shows 7 more Utahns have died from COVID, while 485 are currently fighting the virus from their hospital beds. All of those hospital stays, of course, are not cheap. And starting tomorrow, patients may find themselves having to pay a lot more.
Yeah, KSL Consumer Investigator Matt Gephardt's been looking into just how the cost of COVID is shifting here. And Matt, people who think their health insurance is going to cover it all may be in for a rude awakening.
Yeah, that's absolutely right, Mike Deeney. Good evening. You know, up to this point in the pandemic, insurance companies have been, some of them, pretty generous with what they're willing to cover. Some of them covering 100% of hospital stays for somebody who ends up in there because of COVID-19. Well, now that there's a shot that does a pretty darn good job of keeping folks out of the hospital, those cost burdens are shifting.
It was a really rough go.
Cass Ho was hospitalized with COVID-19 early on in the pandemic.
I was in critical condition, and I ended up being on a ventilator and probably very close to death.
Cass spent 2 weeks in the ICU, and after she got home, came the bills.
I've gotten bill after bill after bill. They came in pages and pages.
But here's the good news for Cass. Of the approximately $125,000 in hospital charges that she incurred, Cass has not had to pay a single dime out of pocket. What her Medicare plan has not covered, her supplemental insurance has. It's been a major relief.
It plays a huge role in the recovery of yourself.
Other Americans have also found that the big hospital bills do not follow them home, with some insurance companies covering 100% of hospital stays related to COVID-19. But 2 major insurance companies in Utah are now changing their policies. Beginning tomorrow, Select Health will apply normal plan benefits for COVID care, and Regents Blue Cross Blue Shield will do the same at the end of the year. Other insurance companies have been billing normal all along. Normal billing means that patients can expect bills for things like co-pays and to cover a percentage of their care. How much it could cost you depends on your plan. The nonprofit healthcare cost estimator Fair Health says the average price for COVID ICU patients in Utah with complexities is about $223,000. So even folks enrolled in healthcare plans where their percentage is low may be getting bigger than expected bills.
Now, because of patient privacy laws, it can actually be hard to get a good idea of exactly what things cost when somebody gets admitted to the ICU because of COVID. If you are comfortable sharing, the KSL investigators would love to see your bills if you're somebody who has recovered after a hospital stint thanks to the disease. You know how to reach us. The telephone number, 385-707-6153, or you can email me, matt@ksl.com.
Yeah, I'm sure a lot of people would like to have that checked out. Matt, thank you.